Good morning. It is Thursday, April 8th, and we're glad that you're with us. The doctor's in. Ask Dr. Arwady is the show. This is the place where you get the latest on COVID-19 here in Chicago, as well as the latest on vaccine, which is what we've been talking about lately.
A lot.
So much so that we weren't here with you on Tuesday because the Vice President Harris, was here to hear about the work that we've been doing here in Chicago and about how successful it's been in terms of efficiency and equity. So good to be with you, those who have been waiting for us since last Thursday. I'm Sybil Madison. I'm your Deputy Mayor for Education and Human Services, always here with Dr. Allison Arwady.
Good morning.
She's your commissioner for the Chicago Department of Public Health. We want your questions. We know we have a lot of questions here to get to, and we want your questions live. You can send them to us using the hashtag AskDrArwady and using Facebook or Twitter to get them to us. So we're going to check our distance.
Looks good.
And then we're going to dive right on into the data.
Sounds good. And before we do that, just want to give a quick shout out. For those who don't know, we're doing a version of this in Spanish. Ask Dr. Luna, who is one of our native Spanish speaking physicians at the Chicago Department of Public Health, one of the medical directors working on COVID. So, that runs on the mayor's page as well. And I just wanted folks to know that that was happening. All right, so let's start with our dashboard. Chicago.gov/coronavirus, that's your one-stop shop for everything related to COVID in Chicago. And if we go to the data, so first, we continue to see increases related to cases, positivity. We're at a 5.2% now for positivity. You can see a week ago we were at 4.5%. And we're seeing about 617 new cases per day on average. That's up from 519 a week ago, or up 19%. We have seen a little bit of flattening in terms of that increase, but some of that is probably due, we often see over holiday weekends some drops related to testing and people kind of maybe delaying to go in and get care. And so the Monday after, for example, we saw a lot of cases, and that is not all necessarily reflected in this data yet. So we're still following. I wanted to show actually a little bit of data. We didn't have, between the Vice President and everything else, we didn't have a chance to do a press conference this week, and we will post this online. But just wanted to highlight that, first of all, this increase in cases is really continuing to be driven by younger adults. You can see here 18 to 29 in red, followed by 30 to 39 and 40 to 49. The dark blue at the bottom is our children, 0 to 17. We've not seen significant increases there, which is good and different than what has been seen in Michigan, for example, where they have a lot of that B117 variant, where things are really not in good control from a COVID perspective. Part of this has been they've seen actually a lot of increase in children, like in that 10 to 17 year, and that is not something at this point we've seen here in Chicago. I also wanted to highlight that COVID is increasing across all race ethnicities. The largest increase has been among white Chicagoans. You can see the red line here is our rate for white non-Latinx Chicagoans, followed by black, non-Latinx, Latinx, and Asian. But you can see, the increase is really across the city. And if you look at the map, the hotspot analysis map, you see here, this is just a comparison within Chicago. So it's where are we seeing more cases than you might expect based on population, and where are we seeing fewer cases diagnosed than you might expect based on population. And really, for those of you who have been following along for a year, this map looks pretty different than what we have seen for a year. For months, we've had a real focus on the northwest side and the southwest side, a little bit on the far southeast side, a lot of heavily Latinx neighborhoods. Those at this point are really looking pretty good. And the south side broadly is also, from a case perspective, not, although cases are increasing, just to be clear, across the city, really the big increase is across the north side in terms of cases. And a lot of that is in younger white Chicagoans. And so just to put a little bit of a finer point on this, we'll post this so you can go back and look at it. But when we break down, where are we seeing the growth? Not just the cases, but where are we seeing the growth? And we look at late March compared to the end of March. Most of that growth was in the 18 to 44-year-old group, right? We had about 1,600 more cases than the week before, and 1,100 of those were in the 18 to 44-year-olds. And about 45% in that age group were among white 18 to 44-year-olds. So that's where we're seeing the growth of cases. However, if we compare that against where we're seeing hospitalizations, it doesn't actually look the same. And this gets into, I know we've been getting some questions about what's happening with rolling things back. Where are we worried about severe outcomes? and at least at this point, if you think about that map that I showed you of where we're seeing a lot of cases, it's not yet reflecting very much of where we're seeing more hospitalizations. To be clear, hospitalizations broadly are down, although we are starting to see them tick back up a little bit, and you can look on the website. We've got a lot of hospitalization data. But over the month of March, you can see, although the numbers were fairly low, the most out of a zip code was 25 people, which is very low compared to what we were seeing at the peak. Still, it is really these farther south side communities, as well as a couple on the far northwest and one here that are seeing more hospitalizations. We did have somebody hospitalized though out of pretty much all of these zip codes, at least one. So still
and
people getting sick.
COVID-related hospitalizations?
COVID-related, yes. COVID-related hospitalizations, exactly, by zip code. And so some of the real focus where we've been concentrating a lot of the effort for the homebound program, really pushing additional vaccine, a lot of the Protect Chicago Plus work right now is down on the south side, and just reiterating that we follow cases, but we also follow these severe outcomes and really need people getting vaccinated across the city. And then this is just, again, making the point about recent hospitalizations by race, ethnicity, and age group. And again, we're at almost 60% of Chicagoans over 65 have gotten a first dose. It is still not enough. Inching. We got to get our people over 65 vaccinated. My biggest worry with this surge in cases is that we are not vaccinated enough among our oldest Chicagoans and those with the most serious underlying conditions. And where younger people, I don't want to see anybody get COVID, because we see young people, it's not always that predictable. We'll see sometimes young people get seriously ill. We see people sometimes have longer effects of COVID. But by and large, the risk for severe outcomes is lower among those in the 18 to 29 and 30 to 39. But if you look here in the month of March, even with a lot of vaccination, we had about 600 or so people hospitalized, and more than a third of those still were in people over 65, and very disproportionately among Black Chicagoans. In the 18 to 44, 45 to 64, and 65 plus, anywhere between 41 and 48% of the hospitalizations. So, just again, we've talked a lot about the fact that Black Chicagoans in general have higher rates of chronic conditions at baseline, more diabetes, more other risk factors that can put people at risk for severe outcomes. And so while we're following cases, I don't want people to see that sort of surge on the north side and think it means if I live on the south side, I don't have to be vaccinated. And then the other thing, just to highlight here, in terms of our vaccination coverage, we have now hit 1.5 million doses administered here in Chicago, which is exciting, and really the data looks so good every day. Across the country, here in Chicago, we're being very efficient in getting it out. You can see about a third now of all Chicago residents have gotten a first dose, and if you limit it to those over 18, it's 41% have gotten a first dose, whereas about 22% have gotten both. But that is a long way to go, and we cannot let up yet. Here's our efficiency data. So as a reminder, the black line shows what the federal government allocates to Chicago related to vaccination doses, COVID vaccines every week. And we set a goal that every week we would get 95% of that vaccine out the door to appointments to providers. We've hit that goal every single week. Last week, 97% of our doses allocated were distributed. And then similarly, we set a goal that not only would we get it out the door, but we'd get it into arms quickly. And so we set a goal that at least 85% of our vaccine week after week would be in arms and reported 7 days later. And we've hit that goal. You can see here the blue shows when vaccine is delivered, and the green is when it's administered 7 days later. And last week we were at 90% of our doses administered. And really most weeks we've been more in the kind of 94, 95%. It was a little bit lower last week, partly because we had a big week for getting Johnson & Johnson, and we knew that it was probably going to fall off. So we held a little bit of Johnson & Johnson to be able to cover Chicago State University and the union sites and some of the work-related and homebound vaccination that we're doing. But we are really doing a very good job, honestly, of getting all of the vaccine that gets to Chicago into arms. Most states are in the 70 to maybe 80% range here, including outside Chicago. And so as soon as vaccine gets here, we've got all the apparatus to get it out. And the last thing here, sorry, I'm just having a little bit of technical problems here. is that where we look at the breakdown of vaccine coverage by race, ethnicity, and age group, I wanted to highlight that we are seeing lagging in coverage for young Black Chicagoans. So if you look at this chart, and we'll post this, as expected, more older Chicagoans have gotten vaccine. This is through March 30th, so it's back from a few days ago now. But you can see that 22% of those 18 to 29, for example, had gotten a vaccine. These would be people with underlying conditions, essential workers. But whereas that's ranged between 22% and 27% for Latinx, white, and Asians, only 7% of young Black Chicagoans had already gotten a vaccine. And in the 30 to 44-year-old group, again, sort of that worker group or folks with underlying conditions, if we look across the other race ethnicities, it ranges from 28 to 38% have gotten a first dose, and only 16% among Black non-Latinx Chicagoans. So we're working really hard to lower barriers here, get vaccine out there. We can talk some more about that if people have questions. Dedicated pods, working with pharmacies. Protect Chicago Plus is going, opening additional sites. But I really want to, we sometimes get questions about, it sounds like cases are now mostly among white Chicagoans. Is it so important to be vaccinating? And given that we're still seeing more of the severe outcomes among Black Chicagoans, and then we're seeing some of these lagging rates, we did want to highlight that. And we're going to be working a lot with community groups and trusted voices on the ground. You're going to be hearing more about faith initiatives, but this is a concern, certainly. And
we'll be doing a lot to increase the confidence.
Yes.
Of everybody, but particularly of Black Chicagoans, so that they can take their turn.
Exactly. And then the very last thing is just, we've been getting a lot of questions about why are these cases on the rise? And largely, honestly, they're on the rise because people are feeling like we're done with COVID, and they are just staying home a lot less. We are all staying home a lot less than we were. And I thought I'd show you this to you graphically. So we follow cell phone movement in Chicago. We do not track anybody's individual cell phone data. We don't store this, but it's an anonymous way of us seeing kind of how movement is happening across Chicago. It's a standard way of looking at this. And if you look here, back in January on the left, this map shows by geography. In darker blue are some of the zip codes where people were staying home the most. The darker blue, those very darkest blue you see on the north side, are where about at least 85% of the check-ins for a cell phone are occurring at home, basically. And then as the colors lighten, more check-ins, people are more out of their homes. And so you can see as we move from January, started to move into February, people are starting to get vaccinated. You start to see some lightening there, not as much on the north side, but starting to see some of that, people starting to move around a little more, which we would expect. And then as we move ahead sort of through the month of February into early March, really seeing some drop off in terms of less people staying home. And then as we go over the month of March, you see we've almost entirely lost that darkest blue. And we've dropped quite a bit in terms of how much people are staying home. And so, yeah, that's the last thing I had. And so, this is just a reminder that we know that people are excited and it's spring and all of the rest of this, but we are not vaccinated enough to be out and about and gathering, especially if there are people gathering who are not fully vaccinated 2 weeks post that second dose. It's critical you're wearing that mask. If there's anyone who isn't vaccinated or is at higher risk, we cannot be letting down our guard yet.
Even outside, right?
Even outside. We've been encouraging people to move outside. Outside is definitely safer, and I love seeing people, if they are gathering, being outside. It's one of the easiest ways to make your gathering safer. But still, masks and distancing, as much as you can, even for outside gatherings. And then we get a lot of questions about vaccine supply, and I did just want to highlight that, unfortunately, and we've mentioned this, but we've seen a big drop in how much vaccine Chicago is receiving, and that is because there was this national story about a plant in Baltimore, and about 15 million doses of the Johnson & Johnson vaccine were spoiled. There was no vaccine that ever left that factory that went into arms, no problems with that, but it really put the J&J vaccine back by about 3 weeks. And so you can see this week, last week, the one that we're finishing up, for the first time, Chicago got 105,000 first doses, more than 100,000, leaving aside what pharmacies are getting or FQHCs. But then as we're sort of looking ahead, what we're receiving to be allocated, it went from 40,000 J&J to 4,800. And so we went from 105,000 first doses to fewer than 70,000 first doses. And really the projection is that for the next few weeks, we're probably going to be at that lower rate. And so we've been working to, of course, try to, we're using all that vaccine. We're very good at efficiency there, but we also have been really pushing the federal government and the state government that where there are vaccine appointments that are going unused, to be pushing vaccine up to the Northeast or to Chicago, because we have a lot of demand here and we're very efficient, but the supply is just not meeting the demand yet, and we're working to push it where we were. So I know that was a lot.
And the J&J was actually making up a lot of the increase in supply that we were getting,
yes,
right?
Right. The Pfizer and Moderna, you can see, is flat and has been flat and is projected to be flat really for the next 3 weeks. So, it's at a pretty good level for us, but we can't, there's not more of that to give. And then the J&J, we know a lot of people are really excited for J&J. One and done, fewer side effects. And it's so helpful for things like our homebound program or workers or, our vaccine bus, which had another really successful day yesterday down in South Shore, where it's not an appointment and you're bringing vaccine and it's, you like take the opportunity and get it done. A one-dose vaccine is just so critical in those settings. And so, we have made additional asks for additional vaccine. I'm hopeful that it may come through, but we've not had any indication that it will at this point. And I see already there's some people who are, commenting about leaving Chicago to get vaccine. And I do just want to mention that where vaccine demand is softer, which is true for a lot of downstate Illinois, it is also true in Indiana. Those sites are open to Chicago residents, and you are eligible at them. And I want to express that I am frustrated that Chicago residents would need to leave Chicago to get vaccinated. But on the other hand, if you have the means to do that, if you are willing to, take a drive, and I did hear that the state is going to be pushing some additional vaccine to some of the Cook County, at least, mass vaccination sites, which is good. I want Chicago residents to know that they are eligible there, and where people do have the opportunity to get vaccinated outside, it does leave additional vaccine for people who don't have the means for transportation, et cetera. So I want to be really clear that vaccine supply is gonna, it's gotta keep coming, right? Like it just has to. But in the meantime, we've put information on our website for how you can sign up for vaccines in more, around the state, and even in Indiana. Indiana's got plenty of vaccine and not enough people taking it. So,
interesting.
Yeah, so we're going to get there here soon enough. But we still have done a lot more vaccinating of non-Chicago residents than vice versa. And it's one of the reasons we tightened up that at our City of Chicago sponsored pod sites, not the employer ones or healthcare providers, we want to continue doing their own patients. But for any of our mass vac sites here, we are at this time limiting them to Chicago residents, just because we've got it with a surge and seeing vaccine rates that even though our efficiency is so good, we're still not up to where we need to be, and not up to where we're seeing settings that have vaccine sitting. We are limiting that at this time, but people are welcome to be vaccinated in some of these settings outside Chicago. We do get your data. I see there's some questions there. We don't get it from Indiana right now, but we're working on that. And we definitely get it if somebody gets vaccinated anywhere in Illinois. And I just want people vaccinated. That's the most important thing. So happy to take additional questions, as needed about that.
So I think you just answered Pam Petrowski's question,
okay.
Right? Which is, I'm a Chicago resident, but if I get vaccinated in a different county, how are people like me counted?
Yep. We use this. There's a state immunization registry that is all very connected, and so we know and have the record of your vaccination if you get vaccinated anywhere in Illinois.
I had a question.
Yes.
I wonder if people might be a little confused about the rising cases being on the north side when that's the area of the city that has had more vaccination.
Yeah.
So Do you think that people might be thinking this is a highly vaccinated area?
Yeah, I think there's a couple of things. Yeah, it's really interesting, and we've been getting a lot of questions about this, and it's not just here in Chicago we're seeing that pattern, by the way. If you look across Illinois, like that Peoria area is having the biggest hotspot, and yet it's one of the most vaccinated areas. And I think this is a mix of things. Number one, we are seeing more variants, to be clear. The CDC announced yesterday or today that they estimate now that the majority of new COVID cases are one of the variants, are one of the B117 especially. That's the one that originally emerged in the UK. We're not actually there yet in Chicago. We don't think that the majority yet are variants, but we are seeing more in Chicago and in Illinois, and where they emerge is where we see more of the spread. And so there's I think if people are even letting down their guard a little bit, with variants, there's more possibility for you to get infected. You don't need as much exposure to the virus. So if maybe you only partly have your mask on, et cetera, it's just easier to transmit. And so part of it is that I think people are, number one, they're just kind of done with COVID and are letting down their guard. Number two, even our more vaccinated areas are nowhere near herd immunity in terms of vaccination. And people, I think, have so much confidence in the vaccine, which I love, but it's not yet at a point, I have all the confidence in the world. If you are gathering in a small gathering with fully vaccinated people, not a problem. But that does not apply to sort of Chicago at large. And when you are out and about, have to keep being cautious. But that it's almost a little bit too much vaccine confidence, I think, in some ways. But I think the biggest thing is just that people are out and moving around. And we see the biggest drop off in those evening hours. People are much more likely to be out and about in the evening than they were even just a month ago. And a lot of that is probably socializing. And, I love that on the one hand from a mental health perspective, but we're just not quite there for people to be letting down their guard just yet.
Got it. Well, related to that eating out and hanging out, at StevieRML from Twitter, you previously said 400 new cases in a day was a cause for alarm. Now we are over 600 cases. Why no new measures or restrictions when we know shutting down indoor dining and gyms works?
Yeah, so it's a really, this has been one of the trickiest conversations. To be very clear, when we are over 400 new cases per day, like we are right now, we are at a high risk, and in fact, with the rate of increase, a very high risk setting in terms of the risk for COVID. So when you are out and about, when you are gathering, we are in a high risk setting for COVID, which means you shouldn't be doing the unnecessary gathering if everybody is not fully vaccinated, et cetera. Part of this has to do with vaccine in the picture, it is not exactly one-to-one against where we were previously. We've been doing a lot of modeling and talking to experts about how do vaccination rates sort of play onto this case rate. The fact that we're seeing those cases circulating so much in the north is also partly because the north side has not been heavily hit by COVID as much as some of those other areas. So there is much less natural immunity, and the virus loves populations that don't have a lot of immunity, whether that's from vaccine or natural immunity. And so even natural immunity, it's not as long lasting as vaccine. We can't fully count on it in a short term, 3-month kind of way. We know there's pretty good protection. And if you think about, our big surge, November, December, we're sort of starting to get past that. But it is, that virus is having a beautiful time circulating in a population that has not seen it as much. The question is, do those cases turn into the more severe outcomes or not? And one of the reasons I showed that data, that the more of the hospitalizations are actually not in, that younger group, and actually geographically, they're not even in the area where we're seeing most of the cases. If I was confident that closing the bars would really help protect against a lot of the more severe outcomes, we would do that. And we may still need to do it, just to be very clear.
The dial is still,
and we have more outdoor options, and we talk about it really every day. We look at this data, and if we have seen, like I said, a little bit of flattening of that trajectory over these last few days, but some of that may be holiday. And if we get on a path, like Michigan, where we're seeing true increases, across the board, major increases in hospitalizations and deaths, I think we're not going to have an option. But my preference is get those older folks and highly vulnerable folks vaccinated, try to encourage the folks who may be more out and about to be responsible in terms of wearing the mask, and to protect those who may be in your bubble who haven't yet been vaccinated. And then I am not concerned, based on what we see now, about things like overwhelming the health system, right? This is really different from where we were before a vaccine. Like in November, December, obviously at the beginning, it wasn't just a theoretical. There were very concrete examples of places as close as New York City absolutely overwhelming their health system, having a lot of unnecessary deaths because of that. We were very worried about that, and we were worried about that in November, December here too. But able to blunt that, that is not a concern at this point. And so it's the concern is, are the cases. The worry is people getting seriously ill and dying from COVID predominantly, yes. And the case circulation is a worry if it turns into those more severe outcomes. So it's not quite as straightforward as it was previously in terms of those decisions. But we continue to really look at it, and if we see things be of major concern, we'll do it. But I think, again, just at an individual level, it is high risk right now to be out and about and gathering in Chicago, and that means taking all the precautions. And we are, just one other thing on that, because I don't know that everybody realizes, we actually have some of the very strictest mitigations in place really across the country still. So, we have a 50% capacity, for example, for indoor within restaurant and bars. We have a maximum of 50 people that are allowed in rooms. We still have a lot of limitations in terms of those gatherings and other spaces. And obviously, we're not at a point, I was hoping to be at a point to be able to loosen that even some more, but that is quite a bit stricter than is required, even in other parts of Illinois, certainly in some other parts of the country. And I am also, we're watching what's happening around the country related to cases and mitigation, and it's just a little different with the vaccine in the picture. So really every day we look at this, and every week we make decisions about it. April for me is really the question here. The models, everything is suggesting that by May, assuming vaccine continues, we should be in pretty good shape. But just these next few weeks, while vaccine is ramping up, we're probably 2 weeks from half of Chicago having gotten at least a first dose, and another 2 weeks from, it's yes. Like we're getting there. We're getting there.
Yeah. So. It's interesting how the context changes what the numbers could mean, or
yes,
right.
Yes.
So this context of now vaccinating the city.
Yes, because the other thing is, in a gathering, those numbers come from, they're national numbers around risk, but they're really about what is the chance of you getting COVID in a gathering size. But now that we've got more people, the real question is your gathering heavily vaccinated in terms of that risk, right? Like there's this different piece in there. So make no mistake, it is a highly concerning to be on the front edge of this northern Midwest surge that Michigan is very much leading, and Minnesota's next, and Illinois is kind of right behind there. But I'm hopeful that in this race of sort of vaccine versus variant, we can continue to be, have the efficiency numbers that we're getting, hopefully get some more vaccine to this area, and and win that race kind of over these next few weeks. VVV.
Okay, so you said something about natural immunity in 3 months, blah, blah, blah. I didn't mean to do that. Perfect. And there's a question here that's related to it from Bernie Dean Johnson Harges from Facebook. How long is the vaccine effective? First it was 1 year, now there's information out there that the vaccine is only effective for 6 months. Please explain this new information, and if it's different based on the vaccine.
Thank you for that question. I have been getting that question so much in various forms, so it's a perfect question. Let me be really clear. So there was news in this last week or two that Pfizer and then Moderna had 6 months of protection. However, people didn't interpret that in the right way. I don't know that the stories were so clear. It wasn't that protection ended at 6 months. It was that 6 months after having been vaccinated, the level of protection, when you look at the antibodies and sort of the immune response in the blood, was just as good as it was when they got vaccinated 6 months earlier. It was not that at 6 months it fell off. That's the longest that we've had people vaccinated, if that makes sense, sort of from the trials.
They continue to follow these folks.
They continue to follow these folks, and they know what they're, because it's not just do I get COVID, it's what do the levels of antibodies and other, there's a number of cells that are related to immune response in your blood, and you can actually follow what is the response, what is the protection. If you think about non-COVID, like if you've ever had to, like for a job or something, you can go and get blood drawn and you can say, yes, I got a measles vaccine when I was a child. They're looking at the level of protection in your blood. We're doing the same thing for COVID. And so the point was that these vaccines last at least 6 months with no drop off in terms of that protection.
Because we're 6 months post.
Because we're 6 months post sort of the earliest, having that trial and kind of where it's been. And so it was good news, it was not bad news, but I think people heard it in some ways as we're 6 months and then we're done. And the other reason why 6 months was important is that the manufacturers needed to show that this protection lasted for at least 6 months to be able to apply to the FDA for the full authorization of the vaccine. Yeah. So we're under emergency use authorization still, right? And this was one of the data points that the FDA really wanted to see, that this vaccine isn't just good for a few months, that it is suggestive to have longer term immunity. And so it was really good news. So I want to just reassure people, like there is no sign that there is waning immunity with these vaccines, right? To be continued, and we'll keep following this. At some point, might you see some waning? It's possible, but we haven't seen it yet. And I think, the other question I get a whole lot of is, are we going to need boosters?
Right.
Are we planning for boosters? There is no plan at this point for boosters. If we need a booster, I think, based on everything we're reading, it's not going to have anything to do with does the vaccine remain protective against the variants we have now. It's going to be about a new emergence of variants or variants that continue to evolve that could evade the vaccine in the future. And so if we needed a booster, it would be more, I think, because even though we're on really good track to get the US very heavily vaccinated, my guess is there will be pockets of the US that are not very vaccinated, and we probably will see COVID continue to circulate there. And then more importantly, internationally, I think it's going to be a very, very big lift to get the high levels of vaccination that we need, and those will be settings that new variants may emerge. So the scientists have been working to make a variant, sort of a virus booster if needed, but that would just really be a booster against a new variant if that changed. And if you'll indulge me one more second, so the question of, the difference between flu and coronavirus, right? Like I want people to understand this. The flu virus mutates like crazy. It's why we need a flu vaccine every single year, because every single year there are brand new variants or strains of flu out there in the world. And so literally what the scientists do is look and see what are the most frequently circulating variants or strains for flu, and we make a brand new vaccine against those strains of flu. But there are so many strains, it's part of why the flu vaccine is not 90% protective. It's lower because there are all these other variants.
So that's a job that's never going to go away.
That's a job that's never going to go away.
Jobs,
Never going to go away. That's right. But the difference is, I read this really interesting article. There's a journal called Virus Evolution, because there are journals about everything in science. And it was Evolutionary Dynamics of Endemic Human Coronaviruses. And they compared sort of how much do flu viruses mutate compared to the other coronaviruses, right? The common cold is often caused by a different kind of coronavirus. And so they found that the influenza virus was getting about 25 mutations per 10,000 nucleotides, which just is something about the genetic material, 25 sort of per year. Whereas in comparison, the coronaviruses were getting about 6 mutations over that same amount of genetic material per year. And COVID-19 looks like it's sort of in the 10 range, more or less, in terms of how fast it's been mutating. So it mutates much less quickly than flu, which is really good news. It's part of why in the real world, protection has continued to be quite good. And we don't know. Is it possible you could need a booster? You could, because it does mutate. But it's at this point, it's not mutating anywhere near as quickly as flu, even though it's had so much opportunity to do so because it's spread across the whole world. So I remain confident that the vaccines we've got right now, I want people to get them now because they're protective broadly against the current variants. That Johnson & Johnson is protective against that South African variant. You see a little bit of drop. It's, you might not have that 95, 94% protection level, Pfizer, Moderna, against some of these variants, but they're still very high in the protection. And getting your protection against those now is what helps protect you in the long term.
Yeah.
They last. Might you need a booster in the future? You might. But it's not something that I see on the horizon in the next, few months. And if we do, it'll be because of variants, I think. More likely, it won't be because the protection from these vaccines are fading against the original variants.
Yeah. Is that you see that I'm just like?
Yeah.
Is that more reason for us to? Because we had that period of time last year when younger people were getting cases more,
yes.
And there might have been a kind of like, oh, well, it's just going to be a cold for me. It doesn't matter. But it seems to me like that's even more reason for us to not get COVID,
yes.
because we don't want these variants
That's
to
right.
keep.
That's right. That's right. It's like, that's the thing about this. It's, people, if they think about others besides themselves, right? It's even if my individual risk is low, when I expose others, I am potentially putting them at risk, but I am also absolutely fueling the spread of variants, like in a way that impacts sort of the Chicago and the U.S. and sort of the whole effort to kind of keep the virus in check. And where we have these sort of hot spots in circulation, that's exactly the kind of setting that could lead us to like need booster doses in the future. Do you know what I mean? So there's this like much larger piece of why we want to be able to keep some of these rates down. And it's one of the reasons why we are, as I think the president really asked to make sure that vaccine is open to all Americans by April 19. We're doing that, and I'm pleased about it because it means some of those younger folks who don't have underlying conditions, are not essential workers. Mm-hmm. We can start getting some vaccine into those settings, but the concern is just where the vaccine supplies. But that's exactly right, and we're absolutely seeing these variants spreading among young people in Chicago.
Yeah. Okay. Ooh, that was a lot. All right, let's go down to Jim Capello's question. He's from Facebook. So if you got the vaccine and you're exposed to someone at work with COVID, do you still need to quarantine? You know how you get the email that says you may have been?
Yeah. So the CDC recommends that you do not. If you are fully vaccinated, what's fully vaccinated?
That's 2 weeks after your final shot.
Exactly, perfect. That you are considered protected against COVID, and you would not need to quarantine after an exposure. There could be settings, I don't know where this person works, if they work in a very high-risk setting, like a nursing home, or in some cases there are individual work settings where they may make some different decisions, but broadly speaking, and this is the same reason why after travel, right, you don't need to quarantine in that setting either. Because these vaccines are very protective. They're not 100% protective, though, to be clear, right? Even those Moderna and Pfizer, it's about 94, 95% protected. And we have had some of these breakthrough cases of people fully vaccinated getting COVID. Not a lot, it's unusual, but it happens. And so we do ask people after an exposure, certainly to be extra careful with monitoring their symptoms, extra careful with wearing your mask. You still should be wearing that mask, of course, at work, even if you're fully vaccinated. And that if there are symptoms, get tested. But generally, now when we're doing these contact investigations, we definitely will protecting people's privacy, we let them know that they were exposed so that they can be sort of extra attentive to their health, but we don't need them to quarantine in the same way.
Got it. Scott Cowan from Facebook. Here is an aunt update. Scott's 75-year-old aunt got the first shot at United Center drive-through last week. She reports it was a very efficient process. Thank you for your advice 2 weeks ago. It helped.
Good, I love it.
So good to get that feedback.
One aunt at a time.
Yeah. Okay, here's another one. Tam Sam from Facebook. Can a vaccine make it possible to not have to wear a mask? I just had to ask Tam Sam's question.
Not yet. Down the line, and this is where we start to get into these herd immunity questions, and we can talk some more about that in a future sort of a future discussion, because that's a big conversation. But right now, while the vaccine coverage rates are still pretty low, right? We're making amazing progress, but Not a lot of us anywhere in the country, to be clear, are at a point yet where we're anywhere near this quote herd immunity, which just means it's hard for the virus to find people to spread to. That's what it means. And as we start to get sort of more toward that, as we start to see cases coming down, we have defined what sort of controlled COVID looks like. We're not going to eliminate COVID unless we have a breakthrough, probably in terms of treatment, or there's something else completely different there. But I don't actually think we will eliminate it. But if we have a very heavily vaccinated population, and especially the people at high risk, the vaccines are almost completely protective against those severe outcomes, hospitalization and death. It will start being more like the regular kind of seasonal flus and colds and things that become part of a problem but don't paralyze society in the same way. And we will be at a setting where we will not have those mask recommendations in place. I think that's going to happen, but it's not going to be for a number of months, would be my estimation. Indiana dropped its mask mandate earlier this week, although they are letting counties continue it, and many counties have. That is in direct opposition to what the CDC and generally the folks who work on COVID recommend across the country. Strong recommendation right now with variants on the rise, cases starting to be on the rise. Vaccine is the most important protective tool, but it is just one, and masks right now are part of our short-term future. If we can get this thing under control, right, get the cases down, get people vaccinated, each of those also takes us closer to a mask-free future. I think people probably on an individual level, we're going to see masks, when people are feeling under the weather, or we'll probably just see some more of it in general in society. But in terms of it being a recommendation sort of from public health, I'm feeling confident right now that it will be something we won't be recommending later this year, but not anytime very soon. Yeah.
Not yet. Okay. KTL from Facebook, what makes people more likely to get side effects? Oh, is there a reason why you might be more likely to get them than besides your immune system, right?
Yep. Well, your immune system is the short answer to that question, but there are things that drive the immune system. So in terms of what we know about this, so number one, older people less likely to get side effects than younger people, and that is just because younger people have more robust immune systems broadly. If you don't get side effects, though, it does not mean that you are not protected. I want to be really clear about that. But we do see, when you look at the whole population, younger people more likely. We've also seen something interesting where women are actually more likely to report side effects than men, and some of this is because women may just be better reporters or more likely to report side effects.
But those men.
Yeah, no, but there probably is something real to this too, because something else interesting for those who may not know as much about immunity is that autoimmune diseases much more likely in women too, and even the more serious, like the allergic reactions, these more serious allergic reactions, more likely in women. And it's because we think, number one, estrogen actually sort of elevates immune response, and testosterone can decrease it a little bit. And women have a lot of your immune modulating genes live on the X chromosome. And women have 2 X chromosomes and men only have 1. And so there's all these reasons that sort of immunity in general shows up a little bit different in women than it does in men. And so we're seeing women a little more likely to report some of these side effects. But broadly, and then the other thing is that people who have had COVID before, we have seen more likely that people will report some side effects, because that is acting, it's acting a little bit like a booster dose to your immune system. Your immune system has already learned some of those lessons of how to protect itself, not in as long a way, not in as protective a way, but there has been, and then again, remember, every single person in the US who gets the vaccine, you don't have to, but they are invited to participate in the vSafe, the monitoring with text message, et cetera, through CDC. And there are plenty of people, just to be really clear, who don't have side effects at all. And if you really look at what some of those numbers are, we talk a lot about them. I was very lucky. I had almost nothing. I had a little bit of a sore arm, but really very little. People do report a little more side effects after the second dose too. That also is probably that booster effect. And so one thing that I've recommended is if there are people who are very worried about side effects, the Johnson & Johnson in the trials had a little bit less side effects. It's, that single dose, can be one thing there. But, in terms of just not everybody getting it, and that comparison. Like for Pfizer, after the first dose, about 20% of people reported some fatigue, feeling tired, whereas after the second dose, about 50% reported some fatigue and feeling tired. But that meant 80% of people didn't report fatigue, right? And so we see that increase. And similarly, like with Pfizer, people reporting muscle pain after the first dose, only about 17% reported muscle pain. 4 in 5 people didn't report muscle pain. After the second dose, it was more like 42%, so like 2 in 5 people. But again, the majority not reporting it. And then where you think about like chills and fever, those more severe, it's only about 7% of people that actually report those kind of more systemic, but then that went up to about 20-something% after the second dose. So you need both doses. This is not a sort of, don't get the second dose. We need people to get the second dose to have that level of protection, but that is, those I think are the main factors that have really come out. But just a reminder that not getting a side effect does not mean the vaccine is not working. The protection levels are just as good in people who don't have the major side effects. But that's some of what drives it. All right.
Well, we are out of time. Do you have any good news?
I have lots of good news. Let's see. I have a little list. One piece of good news, and just for awareness, obviously we're really interested in all the ways that people can get COVID vaccine. And the Jesse Brown VA Medical Center in Chicago is now providing COVID-19 vaccines to all veterans, spouses, widows, and caregivers of veterans. Yeah, no restrictions on age, health conditions, employment, or type of discharge from military service, and they're available either at the Jesse Brown Clinic, 2215 West Harrison, or the Adam Benjamin Outpatient Clinic actually in Crown Point, Indiana is where that one is. So there's information on the website about that, but if you're a veteran or you care for or you're associated with a veteran, that's another way to get vaccine. And we are putting, like I said, more of that information for people who have the ability to travel to get vaccinated, and we'll keep track of that. And I think the last thing, at least in terms of good news, is that, and for awareness, it is actually National Public Health Awareness Week.
I didn't know that.
The American Public Health Association really puts this on, and normally we don't pay a whole lot of attention to public health every year, and so this is sort of a big week to try to educate people about the importance of public health. I hope that this last year has helped people recognize that public health is pretty important. But nevertheless, I do want to just highlight that thank you to everyone at the Public Health Department here in Chicago for all the amazing work that you do this year and every year, and to all my public health colleagues really across the country and around the world, because it's been a year. So,
you are our heroes.
You are our heroes, that's right.
All right.
All right.
Well, the one thing that I'll say is that there are a number of events happening in some of our communities through Protect Chicago Plus this weekend. So we have at Woodson Library on Friday and Saturday, there's a vaccination clinic there for Roseland and Washington Heights residents. On Saturday in Inglewood at UI Health at the corner of 63rd and Ashland, there's going to be a vaccine clinic for Inglewood residents, and we have at least 3 events happening in Little Village. So you can contact Enlace to get more information about that.
And to be clear, we continue to post appointments on ZocDoc really every day. Thousands of appointments, at Wrigley Field, that's our new site, Chicago State University, and really working hard. Go to the website, chi.gov/COVIDvax for more information about how to find through pharmacies. Your healthcare provider remains one of your absolute best places to get a vaccine. Every week we push it to hospitals and everybody else. And as more and more vaccine hopefully ramps up at some point here, we'll be getting it up and available, but do keep looking at ZocDoc for City of Chicago sites public availability as well.
All right.
All right.
Well, everybody do your part to protect Chicago.
Yeah, it's safe, protect Chicago, and have a lovely rainy Thursday. We'll be back on Tuesday.